A wound is a break in the skin or soft tissues characterized by the steady escape of blood, usually from an artery or vein. Types of wounds include contusions or bruises, which is bleeding under the skin; abrasions, which occur when the skin is rubbed or scraped away; lacerations, which are cuts or tears in the skin and underlying tissue; avulsions, which occur when a piece of skin is totally or partially torn away; and punctures, which occur when the skin is pierced with a pointed object. In the case of minor wounds where there is only surface damage and little bleeding, wash the wound with soap and water. Disinfecting the area with an antibiotic will help prevent infection and speed the healing process. Infection is always a concern when an injury breaks the skin. After cleaning the wound, apply sterile dressings. For smaller wounds, use a simple adhesive bandage that can come in all different shapes and sizes. For larger wounds, use square sterile gauze pads and roller bandages. Tetanus is a potentially fatal disease that may result if wounds are not thoroughly cleaned and disinfected. A deeper wound that is the result of an animal bite or occurs in unhygienic surroundings should be referred to medical help. Serious infections may cause the casualty to develop a fever. There may also be red streaks under the skin progressing from the wound. If this is the case, seek medical attention immediately. First aid for infection. Keep area clean. Apply a warm, wet compress. Apply an antibiotic ointment recommended by a pharmacist. Seek medical attention if the infection looks serious. A doctor may prescribe appropriate antibiotics. Special considerations for wounds. When do we need stitches? Stitches are usually needed when there is a complete separation of both skin layers, the edges of the skin do not fall together, and the wound is larger than 1 to 2 centimeters. A closed wound does not involve a break in the skin, and therefore no external bleeding. Signs and symptoms of a contusion or bruise include tenderness, discoloration, and swelling of the soft tissues in the area. Direct pressure on the area to decrease bleeding under the skin. Apply a cold compress to control both pain and swelling. Applying a cold compress will also constrict the blood vessels in the soft tissue and minimize internal bleeding. Be sure to place a thin barrier between the cold source and the skin. Apply cold for 20 minutes every hour for as long as the person feels pain. If it is a more serious bruise, apply cold for 20 minutes every hour for the first 24 to 48 hours. Check and treat for any underlying bone, muscle, or joint injuries.